Hi, Floppycatters. Thought I'd do a vlog video. I haven't done one for a while. Today is April 14th, 2023, and it is about 7 o'clock, 7:30 at night. This is my 13-year-old Ragdoll cat, Trigg. He will be 14 in 4 months. Is that right? Yeah, in August. He had a dental today, and that's what I want to talk about because we used to go to a veterinarian for 20 years, but obviously Trigg wasn't that entire 20 years since he's nearing 14. And today we had our second dental with a new veterinarian. So he's had one before this one that he had today. And if he had had a dental at his old veterinarian today, he would not be alert, walking, etc. So I wanted to talk about the differences in dentals so that you guys can be aware. The cat that's walked into the frame is my other Ragdoll cat, Charlie. He is also 13, will be 14 in 3 months. He turns 14 in July. Charlie is a seal mitted with a blaze. The little white stripe on his nose is a blaze, and then the little mitts you can see. And the seal, you can tell from his ears, his face, and his tail, and his legs. His back legs are actually white up into his thigh. And then Trigg is a blue lynx mitted. And you can see the lynx on his face. He also has white eyeliner. His eyes are dilated still from the opioid pain medication that he was given. Earlier this week, Pam of Perfectly Holistic, who has been helping me with my cats, heal my cats from the inside, sent out an email to her newsletter. So if you want to check out her newsletter, it's great. You just go to Perfectly Holistic and sign up for it, I think. She was listening to the Inside Scoop podcast, and it's a private group on Facebook hosted by Dr. Karen Becker and Rodney Habib. And she had pointed out these things when it comes to dental work. So you want to make sure that your vet clinic has a dental x-ray machine. You want to ask them what kind of anesthesia monitoring equipment do they use besides like a vet technician. Like today I found out that Dr. Sally, who we go to, not only monitors blood pressure, but everything that you would monitor for a human that goes under anesthesia. She knows how scared I am about anesthesia. Chiggy, you gonna turn your buckus around? So do they monitor temperature, oxygen levels, heart rate, and blood pressure? Do they use intravenous fluids? What level of dentistry does the vet practice? High-risk cases and root canals may require a specialist. Can they point out disease in the mouth? Do they wear gloves? Do they provide home care recommendations? So today I had asked my veterinarian to take before and after photos, and someone on the Facebook group was like, oh my gosh, they're not wearing gloves. Well, they were before and they were after photos. So in a few of the photos there are gloves on, but in order to be able to take full-fledged before and after photos, even with him under anesthesia, you've got to lift up that mouth and lift up those cheeks. And then you've got to have someone else taking a photo. And that was all things that I requested. I also requested ozonated saline to clean out his mouth. I think Dr. Sally might already do that. So that didn't bother me that they weren't wearing gloves, but that's funny. Trigg must have let off a leave me alone type vibe right there. So that didn't bother me because it wasn't during the procedure, but if that's something that bothers you can certainly ask your vet. The biggest thing for me is pre-anesthesia blood work. I require it the day of. And some veterinarians, if you just had your blood, if you went to the vet, let's say 2 weeks ago, just for a regular wellness exam, and then they determine your cat needs a dental, then they might take their blood and then make sure they're okay for the dental. His eyes are so dilated. So many veterinarians will use that, and that can be okay. I don't care though. I still want my cats to be tested, I want them an hour before their dental, just to make sure nothing has changed, especially when they're older. So I'm going to leave him be because he's sort of still out of it, but I'm telling you, this is night and day. Usually from our old vet, he would be laying on his side, panting like a mess, and he's so with it. So something else that Dr. Sally does is that she We're gonna go catch up to Charlie. She gives them 300 milliliters of lactated ringers. Like, of course she's gonna make sure that their heart can handle that, but that's her like standard protocol. And she told me today that she gives it before the dental, but I swear that's why her dentals are better, because that fluid helps not only hydrate them because they've been dehydrated all night because you can't give them food, can't give them water, but it also helps to push out all of the drugs that they're given during the anesthesia. So today I asked for pre-anesthesia blood work, before and after photos, x-rays before and after, if the doctor so determines. I learned from a dental that I was able to watch in Albuquerque one time, the Albuquerque Cat Clinic, that you want to get before and after x-rays if you're going to do a tooth extraction, so that you know that you got everything. So if your vet already thinks that they're going to get a tooth extraction, make sure to ask about before and after x-rays. Trigg had a cavity in one of his teeth, and you could like full-fledged see the hole. So I knew he was going to need tooth extraction. So today, Dr. Sally flushed Trigg's mouth with ozonated saline. Pam had suggested to use colloidal silver drops right on the spot where his tooth was removed. So I brought in my Adored Beast colloidal silver for her to use. And then Dr. Sally gave him a B12 shot based on his weight. And then I'm not sure if she did ozonated saline sub-Q or not, but that was something that Pam said might work. And Dr. Sally has worked with Pam, with us, and with other clients, and so I just gave her a list of what Pam suggested. Then when we got home, Pam has suggested that I use 3 different homeopathic remedies. I'll include them below. Hyper something. I can't say these what are they called? Homeopathic remedy names. Gravelins, whatever. That's to help heal the tissues. The hyper one that I just said is for nerve root pain. And then arnica. So the hyper one was twice a day for 2 days. The ruta one is twice a day for 3 days. The arnica is twice a day for 3 days. And then milk thistle for about 10 days. Milk thistle is to help support the liver as it processes out the drugs. I had specifically asked Dr. Sally if we could avoid using antibiotics, and she said, oh yeah, I didn't plan on using them for this. I guess it's kind of old school to use antibiotics on a tooth removal, and that's because I've worked so hard on Trigg's gut that I was like, I don't want to do that. Well, what are you seeing? What was it, Woo? Was it a big bug? What did you see? You went after it like it was something bigger than I thought. Well, I don't know what. But where did it go? It is not as dark outside as it is in my phone frame, so it's a little annoying. All right, well, we're gonna go check out Chiggy one more time. Tig, as you do. Tig. I'm really excited about how Trigg is feeling. Like, he's been very fancy and he's been rubbing on things, and he's not like completely over medicated. He's interested in eating. It's been really great. All right, guys, thanks so much for watching. Please share in the comments your experiences with dentals, and I'll include in the description those homeopathic remedies that I mentioned, as well as the milk thistle that I mentioned, in case you want to try those out on your kitty's next dental. Thanks for watching. We'll see you next time.